Hello everybody, this is Dr. Connors and we are continuing our videos on functional genetics, looking at your genetics for issues, and today we're going to talk about oxalate issues or oxalic acid issues. This is a common problem that is hidden and many times unrecognized with people. Oxalates are a chemical that's found in a lot of really good foods. So things that you may be eating if you've changed your diet and are trying to eat well, oxalates are in a lot of great things. It's actually a protective measure by the plant to keep animals from eating it. Oxalates can be toxic to different animals, and like rhubarb, for instance, when it's in the spring, there's less oxalates in the rhubarb. As the rhubarb ages through late summer, there's a greater amount of oxalates in rhubarb, and it can cause problems with some people, as we're going to see, especially if they have some genetic defects that predispose them to different oxalate issues. People with oxalate problems, like I said, many times it's masked. They think it's something else. Oxalate problems primarily are known for stone formation, kidney stones and gallstones and liver stones and bile duct stones and things like that. But some hidden things are like joint problems, even rheumatoid arthritis and osteoarthritis issues, greater ability to form calcium spurs. So spur forming people, even it's been tied to ankylosing spondylitis problems, arthritis in the spine, as well as muscle issues, achy, painful muscles. Typically people that are diagnosed with fibromyalgia should really look at their genes and see if it's tied to oxalate issues. So anybody with achy, painful muscles, sore joints should really look at if they have oxalate issues, and we're going to look at that. Dietary oxalates really are supposed to be converted and excreted, so we really shouldn't be absorbing a lot of oxalates from our food. And as we'll see, it's the genetic defects that actually decrease this conversion and increase the absorption of oxalates from our food. And so people that have these gene defects are more prone to having high serum plasma oxalate levels, and then as it's excreted through different organs, calcium binds to it and we end up forming calcium oxalate crystals, stone formation. So also different defects cause glycanates in the body to be converted to oxalates, and you increase the creation of oxalates in your own body, and it really has very little to do with dietary oxalates. So just staying away from dietary or foods that have high oxalates is not always the solution for people. Matter of fact, you look at that list and you can search a list on Google of foods that have high oxalates. There's many things that are very good for you that you really want to be eating. So you want to address the reason why always, and that's what we're going to talk about. There's really, so high oxalate levels in your body is called hyperoxaluria. It really means a high amount of oxalates in your urine. But we're not just talking about the urine, as further research has indicated. This is an older name, but it has stuck. It has to do with plasma level of oxalates as well. It's separated into two different forms: primary hyperoxaluria and secondary. Primary has to do with it's from a genetic defect. So we're going to talk about the three different types of primary hyperoxaluria, and secondary has to do nothing to do with the genes, but has to do with gut issues: leaky gut, yeast, candida, overgrowth, fungus issues, dysbiosis, from all sorts of reasons, having gut issues so that you're just absorbing a lot of oxalates through the gut. Has nothing to do with genetics, but just has to do with that it's just passing through the gut lining from a damaged gut. So then you end up with increased oxalates in your body that way. So we'll look at both of these and some solutions for both of these. as we go through this presentation. These are really the genes that we're looking at when we look at primary hyperoxaluria, and we're going to go through these one by one. The SPP1 genes, defects in these genes, and remember, if you got a blank after the gene, that means you have no defect. A 1 means you have a single allele defect, and a 2 means you have a homologous defect or a double allele defect, which means you have even a worse problem with that gene. So the SPP1 genes, it's typically that first one on top there on this chart right here. This is going to be a type of primary type 1, and this is going to be typically a stone former person here as well. But you have to take all these genes in conjunction. The AGXT gene is typically what you're going to read about with primary hyperoxaluria type 1. This gene is found in the peroxisomes in the liver, and its purpose is to make an enzyme to help remove toxins as well as to help dissolve fats. So defects in this gene can lead to fatty liver. Defects in this gene can lead to a decreased ability to get rid of toxins, other toxins in your body, and certainly can lead to increased oxalates in your body. Also, defects inhibit the conversion of glycoxylate to glycine, and glycine is essential. If you remember, if you watch any of my videos on the glutathione pathway, glycine is essential for making glutathione. So defects in this gene can be a kind of a precursor to glutathione issues, and glutathione is your main intracellular antioxidant, so that can lead to cancer issues and other cell dysfunction issues too. This gene is very B6 dependent, and people deficient in B6 with a gene defect here can even have worse problems. So you're going to see in one of the solutions that I'm going to offer is a product that increases B6 load. The type 2 has to do with this GRHPR gene. This makes a specific enzyme that if you have defects in it, you reduce the excretion of ingested oxalate. So you are going to increase the absorption of oxalates, especially if you have any 2s in any of these genes. So any double allele defects in any of the GRH genes, you are going to increase absorption of ingested. So dietary oxalates, you are just going to quite easily absorb those, and this is a major cause of stone formation here. This is also tied to low sulfur issues, and this will, the more oxalates you absorb, it has an inverse proportion to sulfur and B6, so it's going to lower B6 levels and affect that other gene as well. So for this patient right here, this sample patient having a double allele defect on the first GRHPR gene, definitely would be in order to do some things to intervene with that. The type 3 primary is this HOGA1 gene. This person has several single allele defects in this gene. I don't know if they had no stone formation that I would do any nutritional intervention, but maybe some dietary intervention. They are going to overproduce oxalates. It will inhibit excretion, and it will increase plasma oxalate levels. So greater chance for not just kidney stone issues, but joint issues, fibromyalgia issues, because you'll have oxalate crystals in the muscles as well. Secondary hyperoxaluria, you're dealing with leaky gut issues. There are genetic components to that, but we're not talking about the specific oxalate genes. We're talking about the genetic components that lead to leaky gut, like FUT2 gene defects. Also, there's evidence that decreased autophagy increases oxalate issues, so the ULK, the ATG genes, and the FIP genes. These are also on your report that we go over. Will show a decrease in autophagy. So remember, autophagy is getting rid of dead tissues, getting rid of dead cells. Your body's basically garbage system to get rid of these things, and a decreased function in any of these genes are going to lead to rises in oxalate levels. Now, how do you know if you have a rise in oxalate levels? Well, that's a good question. If you have any history of kidney stones or any family history of kidney stones and gallstones and liver stones and such, you already should have a red flag go up in your head, because that's your number one pointer. And you could say, well, no, I don't have any history of that, but you may have looked back at these genes as we go through your genetic profile, and you have a lot of genetic defects in these genes, but you have no history of that. So there are other ways to measure your current oxalic acid load. Great Plains Lab has a organic acid test that measures that oxalic load. So if you know if you have either one of 19 and 20 along with 21 high, like this person does, they're higher on the glyceric acid and higher on the oxalic acid, they definitely have some primary hyperoxaluria going on. So this is one way to measure with a lab test with, okay, I did my genes, and I do have some genetic defects. Maybe they're not horrific, and I don't have any really family history that I know of kidney stones or joint issues or fibromyalgia issues, but I do want to look at my levels. Well, then we can run this lab, and that can give us those levels. So what do you do about it? Are we to stay away from those foods that you saw on that list? Well, we can certainly Google different foods and try to decrease our load of oxalates. And as I've shared in the past, one of the things that we have done in the past before some new products came out is simply giving magnesium citrate and calcium citrate or a magnesium orotate that helps bind the oxalates in the gut and helps prevent their absorption, though it's not perfect, can be very beneficial. Well, just this last month, Methyl Genetics Nutrition came out with an oxalate scavenger product that has not only the magnesium and calcium in there, but it has the B6 in the form of P5P, which is a great form of B6 because remember I said B6 will be diminished with oxalate problems. So definitely with primary hyperoxaluria, that means coming from your genes. So not solely from a leaky gut, but really you have the gene defects that are causing the increased oxalic acid problems or increased risk for oxalate issues. This would be the product to use. Has a little vitamin D, vitamin K2 in it, the B6 as I stated, and the calcium and magnesium, plus a spore-based probiotic, which is really helpful for people with oxalate issues. So this is a great product that maybe we want to go up kind of slow, start at 1 or 2 a day and slowly titrate up to 4 a day. That's listed on this label. And that can really make a difference with people. People can see decreases in their fibromyalgia symptoms. They can see decreases in their pain and their joint pain issues. They certainly see a decreased risk in stone formation. And if you've ever had kidney stones, you don't want to have them again. That's one of the most painful things to have. So this is a great product for that. If you have secondary problems, meaning I don't have the genetic issues, but I have a lot of the symptoms that you're talking about, and I definitely have leaky gut issues, and we measure whether or not we do, but if we measured the oxalate issues with an organic acid test and you had high oxalates, with no genetic issues, then we'd treat for secondary hyperoxaluria, and then we'd use this product, the Oxalate Balancer. So Oxalate Balancer still has some of the P5P B2, and B6 in it. Still has the calcium, magnesium, and a little bit of zinc, but it has some other herbs to help heal the gut, help balance the dysbiosis problem, and help decrease any fungus or candida issues that may be a primary cause of the gut imbalance and increase absorption. This you'd start at about 1 or 2 a day and titrate up to 3 a day. This is another really great product that we're excited to have. Again, if we have not read your genes, or if you have questions about your genes and you are a patient, feel free to call and we can go over these. We didn't cover these with yours because we were concerned more with other things prior to this, since these aren't necessarily cancer function genes. Make sure you call, schedule a time to go over those. If you're watching this video and you're not a patient, we do have some plans that offer genetic workups. So just contact our office, our website right there, and we'll get in touch soon. All right, thank you very much.